My name is John Wingard. I'm a professor of medicine at the University of Florida. I am a cancer specialist, and I take care of patients with blood cancers. This is a group of diseases known as leukemia, lymphoma, Hodgkin's disease, multiple myeloma, myelodysplastic syndromes. In aggregate, over 100,000 Americans develop new cases of these blood cancers each and every year. These are very serious cancers and often are fatal. About 1 in 3 patients with these diseases require a bone marrow transplant for durable control or cure of the disease. A transplant is a very complex medical procedure that requires stringent matching between donor and recipient. And the most feasible source of donors is within the family. Each of us and our siblings have a 1 in 4 chance of being a tissue match. But with shrinking family size, only 1 in 3 of us actually has a family member that would be a suitable donor. Thus, for 2/3 of patients that need these life-saving treatments, we need to identify alternative donors. Well, the National Marrow Donor Program has been established, and there are more than 11 million adult volunteers who have agreed to serve as donors if they are needed to provide transplant. Now, this is very good if you happen to find a donor in this registry. And most Caucasians actually are successfully able to find a suitable donor. However, if you are Hispanic American, only about 40% have suitable matches. And if you're African American, only about 20% of the time are we able to find suitable adult donors. So the vast majority of minorities, in fact, we struggle to find suitable matches. Cord blood is a tissue that is discarded after birth of a newborn baby. It is a rich source of stem cells. It has advantages over adult donors because the immune system of the newborn baby is very immature. And thus, we can tolerate less stringent matching between donor and recipient. And we can perform transplants with mismatches from cord blood that we would never be able to use using adult donors. This can be collected after birth safely without harm to the mother or the baby. And this can provide a grand opportunity to provide transplants for patients who otherwise would not be able to have the life-saving transplant. And indeed, 1 in 3 children, the transplants today are performed using cord blood. And 1 in 3 African Americans in need of a bone marrow transplant have their transplants performed from a cord blood. Thus, cord blood is an option that provides life-saving opportunities for patients who otherwise would not have the opportunity for this therapy. So I'm often asked, why would I want to offer cord blood banking in my hospital? Well, many mothers have heard about it in the press and have questions about it. There are 2 options. One is to collect for private banks, and the other is public banking. Now, there are for-profit companies that offer private banking, and some mothers do choose to do that for their newborn babies. There are fees attached to that. Unfortunately, today there are no known medical therapies that could be used from private banking. And for that reason, many professional societies, obstetrical societies, transplant societies, and pediatric societies have promulgated public position papers that do not advocate that those should be done routinely. There are certain isolated instances where, in fact, brothers or sisters who have leukemia or diseases for which transplants are known indications, where that is appropriate, and we do promote that. However, public banking makes available to individuals in need of a transplant for a therapy that we know to be life-saving today. And individuals who are willing to donate that to the public bank can have that done at no cost to them and provide an opportunity for life-saving therapy to another family. It's really hard to imagine that there could be something more joyous than bringing a newborn into your family. In fact, there is a way that you could add to that incredible joy, and that is to give a new second chance for life to a child of another family at the time that you are experiencing the joy for your family. I'm often asked what is involved in the procedure of cord blood banking. Well, first, that the mother is consented before the onset of labor. During the delivery procedure itself, the baby is delivered as ordinarily. After the cord is clamped and severed, the remainder of the cord that is still attached to the placenta is cleansed and a needle is introduced and the blood is drained. Ordinarily, there are about 2 to 3 ounces of blood that is drained, but within that are over 1 trillion blood cells, of which about 1 to 2 million are known as stem cells, and those can be used for transplantation. That can be collected by gravity or syringe aspiration over a several-minute period of time. Then the remainder of the tissue is discarded as ordinarily would be done after delivery of the placenta. Following the collection of the procedure, the nurse or technician which would do the collection would label those and set them aside for the cord blood bank to pick up. The cord blood bank staff would ask the mother additional questions, the types of questions that would be asked of any blood donor to screen for infectious transmission, and also some information about family diseases that may be transmitted by heredity. Thus, so the whole process would add only a few extra moments. It does not necessarily require the physician to draw these samples, but in fact, the nursing or technical staff could do that. So in my day-to-day job working with cancer patients, one of the joys that I experience is when I go to the clinic and I see patients who I have cured of their cancer through a transplant. And they share experiences of their children that they have lived to see grow up, but would not otherwise have done so had they not received that life-saving transplant. Sometimes our treatments do not work, and I'll sit with the family who are dying and provide comfort to that family. And although this is typically a very sad experience for all of us, we know that we've done everything that we could to offer them the best chance for life. But the worst thing imaginable as a transplant clinician is knowing that there is a treatment that offers the prospect for cure, and to not be able to offer that to a patient who will experience a lot of suffering and death in the upcoming months if they don't receive that transplant. Donation of the cord blood will provide those opportunities for cure that they otherwise would not have to children, to minorities, and other families, and this can provide a lot of joy to other families. If you are an expected mother, you may receive contacts either through the mail or through the media from private cord blood banks providing information about banking for private use of the cord blood that your infant will have. And these are certainly opportunities, and some individuals will choose to avail themselves of this. It's important to note that currently there are no known medical uses for that privately banked cord, and it is quite expensive. So when you think through the process of should I do that or not bank blood, it's also important to remember that there is yet another option, and that is to donate the cord for public use. This is providing cord blood for known medical therapies for children and adults with blood cancers or serious blood diseases who rely on donations such as from individuals as yourself for curative therapies that they otherwise would not have the opportunity. Cord blood banking is particularly important for minority populations. And the reason for that is that in the National Marrow Donor Program, although there are more than 11 million adult donors, only a small proportion of those are from minorities. Despite efforts to increase representation, and there are increasing proportions in these donor minorities, there still remains a lower likelihood that you will be able to successfully get a suitable match from adult donor registries. There are a variety of reasons for that. One important reason, particularly for individuals of African descent, is that the African population is older, and there is greater genetic diversity in African populations. And so there are more and more possible different types of tissue matching molecules. Thus, it is more difficult to find stringently matched donors. The nice thing about cord blood is the immature immunity of the cord immune system is the advantage of cord blood is that the immune system is more immature, and there are opportunities for greater mismatches to be well tolerated by the recipient. And thus the immune system of the cord is more forgiving and allows greater degrees of mismatch. So that cord can be used for a greater number of individual prospective recipients. Yeah. So I'm a transplant clinician. I am also a cord blood banker. So I actually see both sides of the issue. And the reason that I got interested in cord blood banking was the difficult situation of having patients that I could cure with a transplant, but not having a donor option. So I would not be in a position of offering that life-saving therapy to those individuals. That's a very heartbreaking situation as a physician, knowing that I have a therapy that I could really, truly help that individual, but my hands are tied not being able to offer that. Cord blood banking really does address this in a meaningful way, and I have seen many of my patients be cured using cord blood that otherwise I would not have that opportunity. So individuals with one type of cancer that is life-threatening are difficult situations, but sometimes individuals with one cancer will have a second cancer. and that makes the situation even more difficult. The treatments for one cancer may have very little effect against the other cancer. And for one to proceed forward with a transplant, you need to have some degree of control over both cancers. So a therapy that may be effective against one may not achieve the control over the other, and vice versa. Getting both to be in a good controlled state is like aligning stars, which could be very, very challenging. Moreover, there are toxicities from the therapies, and when multiple therapies are being administered, there's a very great degree of toxicity. One of the toxicities that can be particularly problematic is suppression of the blood counts in the immune system that we need to protect us against infection. So pneumonia and other infections commonly occur with these therapies. For a transplant clinician as myself to take a patient to transplant, I need to have the disease fairly well under control, even though I know it's not been cured, and all the infections to be under good control so that there is sufficient time for the transplant to take hold in the recipient and for the immunity of the graft to have become more robust to help fight against the infections. These are very difficult when one has one cancer, and even more challenging when you have multiple cancers. LifeCord is one of about 24 public use cord blood banks in the United States. We have been collecting cord blood for nearly 15 years now. We are one of the charter members of the National Marrow Donor Program Cord Blood Consortium. We have been continuously accredited for over a decade. We are just the 5th bank to actually have our manufacturing procedures approved by the Food and Drug Administration for licensure. A very rigorous set of standards, validation procedures, and standardized operating procedures that we have had it reviewed and approved by the FDA. We are one of just 13 cord blood banks that are approved by the Federal We are one of just 13 cord blood banks that HRSA has approved for funding to assist us in minority recruitment. We consistently review the outcomes of transplants with our cord bloods, and the outcomes that the transplant patients have achieved are very comparable to any other cord blood bank in the country and worldwide. So we're very proud of the quality measures that we've done. We recognize that minority recruitment is a huge emphasis for the program that we have, and we do feel that what we're doing is adding a great deal to the communities that we serve. Your contribution of cord blood offers the prospect of saving lives globally.